A seismic shift is occurring within the CDC's Vaccine Advisory Committee, one that's sending shockwaves through the public health community. Picture this. 5 new members are set to join the CDC's Advisory Committee on Immunization Practices, ACIP, this week. But their credentials raise more questions than answers. Some have no proven track record in vaccine science, while others have publicly challenged the safety and efficacy of vaccines, including those for a global pandemic. This isn't just a personnel change, it's a potential turning point in how the US approaches infectious disease control. And here's where it gets controversial. These appointees aren't being selected for their expertise, but for their vocal skepticism, particularly toward vaccines that have saved millions of lives. Could this signal a broader ideological shift in public health policy? Let's unpack the implications. The timing is anything but ideal. Just weeks after key CDC leaders resigned over claims of political interference and unscientific decision-making, these new members are stepping into roles that could reshape vaccine guidelines. Tara Smith, an epidemiology professor at Kent State, warns that the committee's agenda may prioritize ideology over evidence. It's not about deep expertise in vaccination, she says. It's about amplifying anti-vaccine rhetoric to restrict access. Jessica Steyer, a public health scientist, echoes this concern, highlighting the systematic replacement of seasoned vaccine experts with individuals who've questioned foundational scientific consensus. With measles outbreaks surging and respiratory virus season looming, she adds, policy changes based on misinterpreted data could have catastrophic real-world effects. What's on the table? This week, the ACIP will vote on 3 critical vaccines: the MMR and chickenpox combo shot, the hepatitis B vaccine for newborns, and updated recommendations for the COVID vaccine. These decisions don't just impact policy. They shape insurance coverage, school mandates, and the availability of free vaccines for low-income families. Without ACIP's stamp of approval, Steyer explains, parents might lose the ability to protect their children altogether. The stakes are clear. A single vote could delay the hepatitis B vaccine from birth to age 4, risking a resurgence of a virus that once devastated communities, but has been nearly eradicated in young people. But the controversy runs deeper. Several new members have ties to anti-vaccine movements. Take Catherine Stein, a professor at Case Western Reserve University, who once argued that Christ's approach to lepers, touching them without masks, was a model for pandemic behavior. Her writings, laced with religious ideology, dismiss mask mandates as symbols of fear and downplay the virus's lethality during deadly surges. She also collaborated with Health Freedom Ohio, an organization linked to Robert F. Kennedy Jr.'s Children's Health Defense, a group notorious for spreading vaccine misinformation. Then there's Kirk Milhorn, a pediatric cardiologist who has pushed for halting the COVID vaccine due to the rare risk of myocarditis. Despite evidence showing its benefits far outweigh the risks, his advocacy for ivermectin, a drug with no proven efficacy against COVID, has drawn scrutiny from medical boards. The list goes on. Evelyn Griffin, an ex-OBGYN turned holistic health advocate, has claimed vaccines are unsafe and participated in anti-vax webinars alleging links to infertility. Hilary Blackburn, a pharmacist and daughter-in-law of Senator Marsha Blackburn, has suggested vaccines may trigger autoimmune issues. Even Raymond Pollock, a transplant surgeon, has a shadowy public profile. Together, these appointees form a committee that's more aligned with a political and ideological agenda than scientific rigor. And this is the part most people miss. The committee's structure is still incomplete. With 6 more seats to fill, the CDC's vaccine guidance could become a battleground for conflicting priorities. The Evidence Collective, a watchdog group, has already documented over 50 falsehoods from the first meeting of this new ACIP. As the committee votes this week, the public is left to wonder, should vaccine recommendations be shaped by data-driven experts or by individuals with a history of spreading doubt? Is it ethical to let ideological skepticism override the lives of vulnerable populations? We'd love to hear your thoughts in the comments. Do you believe the CDC's new direction will protect public health or undermine it?